Good day, ma'am, and to each and everyone. So my name is Eliza Ferris from BSN1A of Ileana Doctors College. And for today, I'm going to perform a turn demonstration in regards of assessing the abdomen. So prior to performing this procedure, we need to, of course, perform hand washing or hand hygiene and done our PP if there's necessary. So I have here an alcohol that serves as my sanitizer. And for this assessment, we'll be needing it is important for us to prepare all the equipments needed. And we will be needing, of course, an alcohol for the hand hygiene, drape, stethoscope for auscultation later, and we have a tape measure for measuring the abdominal girth. So the next thing that we're going to do is to proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm fine.
Okay, that's great to hear. So, by the way, my name is Eliza Ferris, and I'm your student nurse for today. So, can you kindly confirm to me your name as well as your date of birth, please?
Ferreros, November 6, 1971.
Okay, thank you for that. So, I think we're good in here. So, what would you like me to call you, ma'am? Is it by your first name or your last name?
First name, please.
Okay, thank you for that, ma'am. So, the next thing, of course, the first thing that we're going to do is to identify our patient. So, this is to ensure that we have the right patient in front of us. And it is also important to establish rapport and introduce ourselves towards our patient. So if there's any curtains or doors within the areas, we need to close them in order for us to provide privacy to our patient. So the next thing that we're going to do is to, of course, explain the procedure to our patient. Okay, Ma'am Fez, so I'm here to perform the assessment of your abdomen. So why do we have to do this? So this is to ensure that everything is normal. And if there's any abnormalities that occur in your abdomen, just like a sign of appendicitis, if there's any tumor, cyst, any lesions, or any skin discoloration. So we need to take note all of those abnormalities in order for us to prevent further complications. So do you have any questions with that or any clarifications?
No, ma'am.
Okay. So don't worry, ma'am. If you do have any questions all throughout the assessment, you do have the freedom to do so, okay?
Okay.
All right. So the next thing that we're going to do, of course, is to position our patient in a supine position in order for us to have a good assessment. So, Malfa, I'm going to assist you to please lay down so that we can have our assessment proper. So before we proceed with the first procedure, ma'am, have you already emptied your bladder?
Yes, ma'am.
Okay, so I'm going to drape you first. Okay, so I'm going to unbutton your shirt, ma'am, again. Okay, so we are done on draping our patient. So we are going now to proceed to the first procedure that we're going to do, which is what we call inspection. So what are we going to inspect here? So we are going to inspect for the overall skin color, abdominal skin color of our patient. So as I'm inspecting my patient's abdominal skin color, she has a pale color compared to the other parts of the body because it is less exposed to the sun, which indicates that that is a normal color. So if there's any purplish discoloration of the flanks, so it indicates, or what we call a gray turner, it indicates the bleeding of abdominal wall. So if there's any discoloration, it's like also yellowish color indicates jaundice, redness indicates inflammation. And if there's any pale and taut skin, which indicate that usually can be seen on a patients with ascites. So there are no, as I'm assessing my patient's skin color, there are no abnormalities so far. So the next thing that we're going to do is to check for the vascularity, striae, lesions, and rashes. So for the vascularity, okay, so as I'm assessing my patient's abdominal, she has there are veins that are scattered, which is visible, and that indicates that is a normal result. So if there, and the abnormal result for this is if there is any dilation in veins, which may be seen usually in the patients with cirrhosis of the liver or ascites. So the next thing that we're going to do, check here is for the striae. What is striae? It is usually what we call a stretch mark. So for the new striae, it has a pink and bluish color. So in my patient's case, she has a old striae, which it has a white color and linear structure, and due to her past pregnancy or weight gain. And that is a normal result. So if there's any dark bluish purple discoloration, it is associated with Cushing syndrome and may be caused of ascites. So in terms of lesions and rashes, there are no occurrence of lesions on my patient's case. There are no lesions, no rashes, and there are flat raised brown moles that can be seen on her abdomen, which is a normal result also. So the abnormal indication for this, if there is any bleeding of moles or if there is any changing of mole size, shape, as well as the border of symmetry. So we need to take note of that abnormality. So the next thing that we're going to inspect here is for the hair distribution. So far in my patient's case, she has no abnormalities on the hair distribution, which is good. And the next thing that we're going to inspect here is for the symmetry and contour of the abdomen. So here, as I'm inspecting my patient's abdomen, right, she has a symmetry. She has a flat, round, and scaphoid abdomen, which is good. So if there is any generalized protuberant or distended abdomen, usually it can be seen with the patients with obesity or if the patient has the air or fluid accumulation. So we need to take note of that abnormality. So far in my patient case, she has a normal finding. So the next thing that we're going to inspect here is for the surface movement. So in surface movement, we are looking if there's any peristaltic waves or pulsation, any pulsations or in aortic part. Okay. Right, so as I'm inspecting my patient's abdomen, she has a slightly pulsation in the aortic, slightly pulsation of the abdominal aorta. And usually, the abnormal indication for that is if there is a vigorous or wide pulsation that can be seen on, usually in patients with abdominal aorta aneurysm. So we need to take note of that. But in my, and in terms of peristaltic wave, the peristaltic waves cannot be seen, which indicates that that is normal. And the next thing that we're going to do is to, of course, is to inspect for the location, contour, as well as the color of the umbilicus. So here, as I'm inspecting my patient's umbilicus, she has the umbilicus is at the midline, at lateral line, which is normal. So if there's any deviated umbilicus, which is usually caused by hernia or fluid or mass. So far my patient has a normal finding. And in terms of the contour, the umbilicus of my patient resists and protruding and no more than 0.5 centimeter. Okay. And it is round also and conical. The umbilicus is round and conical. So in terms of color, the umbilicus color is same with the skin tone of the abdominal, which is good. And if there's any, and the abnormal indication for this, if there's any bluish or purple discoloration, it is what we call a Cullen sign around the umbilicus. So if there's a bluish or purplish discoloration around the flanks naman, it is called a gray turner. So the next thing that we're going to inspect here is to measure for the abdominal girth. So we will be needing a tape measure for that. Okay, so and after we measure that, we are going to, in fact, I'm going to lift you. Okay, just a moment. Okay, in measuring for the abdominal girth, we are going to measure it around the umbilicus. And then after that, we are going to document the finding for the abdominal girth. Okay, so why do we have to measure for the abdominal girth? So usually we are testing here if the patient has the abnormalities in terms of the shape of the abdomen. Okay, thank you for that, nonsense. So the next thing that we're going to do is to check for the auscultation. So for the procedure of auscultation, of course, we will be needing a stethoscope. Okay. So in auscultating the abdomen of the patient, we are going to, of course, auscultate first the right upper quadrant and right lower quadrant, followed by left upper quadrant and right and left lower quadrant. Okay, so we are going to observe for the bowel sound. Okay. So as I'm inspecting my patient, as I am auscultating my patient's abdomen or the four quadrants of the abdomen, it has a soft clicks and gurgling sound, which indicates that is a normal sound. And of course, the abnormal indication for this, if there is an hyperactive sound, that is rushing, which indicate the diminish of bowel motility. So the next thing that we're going to do is to percuss the four quadrants. So we are going to check here for the tone of the four quadrants. Okay. Okay, so the tympani predominates over the abdomen because we heard a tympani sound because of the air in the stomach and in the spleen. So the abnormal indication for this, of course, is if there's an hyperresonance is heard over the gaseous distended abdomen, and the abdominal dullness is heard over distended bladder, or usually in patients with ascites. So the next thing that we're going to percuss is we are going to percuss for the liver. So first we are going to percuss the lower border of the liver, and then we are going to percuss it up to the upper part of the chest. Okay. Okay, so as we percuss for the liver, the lower border of liver has dullness sound in my patient case, which indicates that that is a normal indication. So if there is a dullness of the liver is difficult to estimate, of course that is the abnormal indication for that, because it indicates that there is an obscure on the intestinal gas. And also in the upper border of the our patient, there is a dullness also that is being heard. Usually it is located between the left and 7th intercostal space from 1 to 4 centimeters. I'm sorry. And usually if there is a difficultyness in estimating the dullness sound, it is the obscure of the pleural fluid of lung consolidation on the upper border of the liver. And then, in measuring for the normal span of the liver, we are going to measure it with tape measure, and it is usually has the 6 to 12 centimeters. So normally, the liver decreases after the age of 50, and if there's any what we call this, if there's any if the liver span is increasing, that is what we call hepatomegaly, which is the liver is enlarged, and atrophy if the liver decreases. Okay, so we are going here. So in my patient's case, she has a liver span of 10 centimeters, which is normal. Okay. So the next thing that we're going to do is to percuss for the spleen and the location. And remember that if the liver is in lower position than normal, it may indicate that the patient has a emphysema. And if the liver of our patient is in higher position than normal, it may cause by abdominal mass or ascites. So here we are going to percuss now the spleen. Okay. Okay, so spleen is in the oval area of dullness and approximately 7 centimeters. So the abnormal indication for this is what we call splenomegaly, which is characterized by dullness or greater if the size is greater than 7 centimeters wide. So normally, we can hear a timpani sound in this area, and the abnormal indication for this is if the inspiration of our patient at the last intercostal space suggests the enlarge of spleen. So the next thing that we're going to check here is we are going to percuss for the kidney. I'm going to ask my patient to sit in order for me to perform a blunt percussion. Ma'am, I'm going to ask you to please take it as sit for reading. Okay. Okay. So you are going to tell me, ma'am, if you feel any tenderness or pain, okay?
Yes, ma'am.
You feel any pain? Okay. Right, so let me assist you. Okay. Thank you. So as I percuss the kidney part of my patient, she doesn't complain for any tenderness, which is normal. And the next thing that if there is a tenderness, of course, the abnormal indication for that is there is a kidney infection. So the next thing that we're going to do is to percuss for the bladder. So here we're going to percuss it here. Do you feel any pain? Okay, none. So of course, the abnormal indication for this is there is tenderness. So far in my patient's case, she has a normal finding. So the next thing we're going to do is to percuss for the shifting of dullness. It is to test for the ascites. So we are going to percuss the flanks from the bed upward to the third. Okay. You're going to tell me, ma'am, if you feel any tenderness, okay? Or pain. You feel any pain?
No, ma'am.
Okay, so far that's good. So, okay. So when the person has the what we call ascites, usually the fluid assumes that the pendant position protrudes dull percussion tone and around the flank. So air arises to the top and tympani is being percussed. That is the abnormal indication. So the next thing that we're going to do is to do the next procedure, which is what we call palpation. So first we're going to do the light palpation. So we are going to palpate it lightly, the 4 quadrants. Okay, so I'm going to palpate you here, ma'am, and you're going to tell me if there's anything. You feel any pain, ma'am?
No, ma'am.
Okay. Alright. So I think that is a good finding. And the next thing that we're going to do is to do the deeply palpation. So we are going to deeply palpate at the 4 quadrants and to check if there is any muscles. Do you feel any pain?
No, Mom.
Okay. So I think we're good in here. So normal, usually if the patient complain for tenderness, it is normal because it is possible in the areas in scaphoid, aorta, sacrum, as well as in ovaries with the deep palpation. So if there is, if the patient complain for the severe tenderness or pain, it may related to, or it may indicate a trauma, infection, or tumor. There are no masses that is being palpated. And if there is a mass, we are going to take note of that because it indicates abnormalities. So the next thing we're going to palpate is for the umbilicus. So here, umbilicus. Okay, so I'm going to palpate it here now. And then you're going to tell me if there's any pain or slightly pain. You feel pain, slightly pain? Alright, none. Okay. So there are free, the umbilicus of my patient is free from masses, any masses swelling. And that is good. So if there is a soft center of umbilicus that is being palpated, it may indicate that that the umbilicus of my patient has the potential of herniation. So the next thing that we're going to palpate here is, deeply palpated here, is for the spleen. So here we are going to ask our patient to inhale in order for us to locate the spleen of our patient. Okay. Can you please inhale deeply from another one? Okay. So usually this spleen cannot be palpated, which is abnormal. So if you can palpate a spleen, it indicates that there is usually an enlargement of the spleen, and that we need to take note of that because it is due to irritation or trauma. Though the next thing we're going to inspect here is for the liver. So here, usually the liver is not palpable, but we are going to deeply palpate it here to our patient. Okay, can you please deep inhale, ma'am? Do you feel any slightly pain?
No, Mom.
Okay. Alright, so if there is any tenderness that is being palpated as we deeply palpated the liver of our patient, it indicates usually what we call a cancer. So the next thing we're going to check here is for the deeply palpated for the kidneys. So here we are going to ask our patient to lift a little bit, and we are going to use our left hand as a support here on the posterior part of the flank, and then as we are going to deeply palpate the right lower quadrant. Okay, you are going to tell me, ma'am, if there is any pain or tenderness. Do you feel any pain?
No, Mom.
Okay, that's good. So that is a normal indication if the patient doesn't have a complaint for any pain. And usually, if there is a tenderness, or if you can palpate the kidney and it has the enlargement, it indicates that there is a cyst or tumor on the kidney of our patient. So far, there are no abnormalities that indicates a tumor or cyst. So the next thing that we're going to check is for the bladder. So we are going to check here if there's a distended bladder. Okay. You feel any pain?
No, Mom.
Okay. So for the empty bladder is usually neither palpable or not, but in my patient's case, there are no severe, she doesn't complain any severity in terms of the pain. So the next thing that we're going to check here is for the special tests. So here we are going to check for the Blumberg's rebound tenderness. Okay. So in Blumberg's rebound, as we apply the pressure on the abdomen of our patient, and it complains about the tenderness, it is what we call the indirect tenderness. And if our patient, okay, I'm going to apply pressure. You're going to tell me if there's a pain, okay? Okay, so if the patient complained that as we apply the pressure and palpate the abdomen and release it by lifting up our hand, and the patient complained about the pain, that is what we call rebound tenderness. But in my patient's case, she doesn't complain for any tenderness, which is good. So the next thing that we're going to check here is to check for the iliopsoas. So here, I'm going to ask my patient to lie on her left so that I can check for the iliopsoas muscles. Okay. So I'm going to hyperextend your right leg. Okay, so you're going to tell me if you feel any pain here in your abdomen. Okay. Do you feel any pain?
No.
Okay. Alright. So in terms of the iliopsoas, so there are no abdominal pain that is being complained, and the pain in the if there is any pain on the right lower quadrant, it is associated with indication of or irritation of iliopsoas muscle. So next thing we're going to do is to test for the obturator. So here we are going to ask our patient to lay in a supine position. Okay, yeah. Okay. Not fast, so I'm going to flex your knees and thigh, and you're going to tell me if you feel any pain on your abdomen, okay?
Yes, ma'am.
Okay, so I'm going to rotate it externally and internally. Do you feel any pain?
No, ma'am.
Alright, okay. So, if the patient doesn't have complain for any pain, and that is a good result. So, if there's any pain that is being complained, there is an irritation of obturator muscle due to appendicitis. So, the next thing that we're going to check here is for the hypersensitive. So, we are going to grasp the skin of our patient here on the lower quadrant of our patient using our thumb and index finger. And if the patient complains, there is an indication of appendicitis, but if there's none, that is a normal finding. Do you feel anything?
No, ma'am.
Okay, thank you for that. So as I do the test, she has a normal finding, which is good. So the next thing that we're going to check here is for the inspiratory arrest, or what we call Murphy's. So here we are going to ask our patient to take a deep breath, and then if there is no tenderness, it indicates that is a good result. Okay, so you're going to take a deep breath, okay? Okay. Deep breath for me. One more time. Okay, last. Okay. So do you feel any pain as I do
No,
the test?
ma'am.
Okay. So the abnormal indication for this, if there is any sharp or sudden pain causing them to abruptly cease inhalation, usually this can be seen in a patient with cholecystitis. So the next thing that we're going to do is to do the test for the special test. So here we are going to check for the variation using the single hand or by manual method. So, okay. So once you're going to tell me if you do feel anything. Okay. Do you feel any pain?
No, ma'am.
Okay, so far there is no pain that is being complained by our patient, which indicate that that is a normal result. So if there is any tenderness or pain, as we do the allotment test, it indicates abnormalities, which is usually a problem on the kidney. So we are done on assessing the abdomen of our patient, and after that, we are going to assist them in a good position, okay? Ma'am, thank you. We are done in assessing your abdomen. You may take a seat.
Thank you, then.
Okay. So I would like to thank you for your cooperation. We are done assessing your abdomen. And after that, of course, we are going to perform hand washing or hand hygiene. And then we are going to document all the findings for the assessment of the abdomen. And that's all. Thank you.